Okay, we have a lot of things to talk. Today, I'm not going to present any case because we need to talk about a little bit of scientific literature. So that's what we are going through now. So, what's the big trend in the pet market? Ozone therapy. This is a paper from 2024, and we know that ozone treatment and CBD are in the trend. So people are discovering ozone treatment, and we are having more and more studies, not just in vet medicine, but also in human medicine. Again, is ozone safe? I use an old paper just to remember all of us that ozone is safe. It's non-mutagenic, non-carcinogenic in nature. So since 1977, it has been used for disinfection of drinking water, just to remember us that we are dealing with something safe and with something that is in the trend of trying to preserve our environment. So ozone is in this trend as well. Again, is it safe to perform rectal insufflation? Here I'm going to perform a parallel with another study. They did rectal insufflation for surgery, and they use more than 5 liters per minute in the rectum for to try to distend it. So when we use our intrarectal ozone with a syringe, it's really safe. Even if you use 120 milliliter, it's still safe. We don't have pressure. So ozone is really safe, and rectal insufflation is safer as well. But studies in veterinary medicine, we have some studies on the effect of ozone on dentistry. This is also new. We in Brazil use ozone for human dentistry for more than 20 years. If you Google about ozone and dentistry, you are going to have thousands of research from Brazil because we use it a lot. But in veterinary field, this is something new. So we are starting to use this as antibacterial, intraoperative. So we have seen the efficacy to dry alveolites. We have seen that ozone water has less toxicity for the gingival cells than chlorhexidine, and ozonated water can be used for irrigation of dental alveolus without interfere with periodontal ligaments or with the health cells. So ozone in veterinary dentistry is also a new trend with new research coming on. Of course, we have to go through some obstacles for the ozone therapy. What are some of these factors that might hinder the use of ozone? Instability. So it's important to understand that this is unstable. So we need to use when we produce it. So use it immediately. We have a variability of ozone application because we have different animal species and we have different disease. So it's difficult to have a guideline by now. We will have it, but it will take time and a lot of work because we have different problems, different species. We also have limited case reports and some studies with lack of consistent evaluation of results, and we need to standardize our treatments. So those are some factors that may or may not contribute to the acceptance of ozone, and we need to go through it and face it. Ozone is unstable, so the preparation cannot be extemporaneous. So we need to prepare and use it. Again, another paper that asks us to have a careful appraisal on the ozone. So we need to do research, we need to publish it, and we need to try to make some guidelines on the use of it. So papers are concerned about it. Ozone can be used for large animal as well. We use it a lot for reproductive disease and wound healing. We have been working with a lot of research on the reproductive tract in Brazil. And now we see universities in USA also interested in doing research on ozone and reproductive system in horses as well. So it's a new trend, the use of ozone not in reproduction because this is old, but the new research coming on from the United States. So this is very interesting because we know that the United States does a lot of good research and with technology and paper that are well designed, and this is good for ozone therapy. So in this paper, they also highlights the effects of the reactive oxygen species and the lipoperoxides reactive species as well. So depending on which ozonide, which substance molecule we are producing, we are going to have different biological effect. So we can have effects on erythrocytes, leukocytes, platelets. We can also activate growth factor. We can stimulate NRF2 pathway, which will increase our or the patient antioxidant capacity and also release nitric oxide, which will help with blood circulation. We have some review on the use of ozone for reproductive disease. So those are old papers, and it's nice that they are old because it means that we have been looking for it for a long time ago, and we are still looking on it, which means that this is effective. Because if we have looked for something in 2012 and it was not effective, we would not be here in 2020 looking for it again, and in 2024 again. So it means it works and people has put their eyes on it and they have screwed up the ozone idea and use in reproductive tract, and they know it can be a very interesting tool. New studies on mechanism of action. Ozone has an aromatic way, which means that something that might cause harm at low dose or low concentration can do good, which means that when we have peroxides, when we have aldehydes using low doses of ozone, it can work as a signaling molecule. So this is a paper that highlights the effect of peroxides, aldehydes, which are commonly linked with oxidative stress when used in low concentration as the one produced by ozone. In low doses, it can act as a signaling molecule. We also know that this reactive species of oxygen can also activate the mitochondrial biogenesis, can decrease inflammation. This is a new word that's coming up, that's pyroptosis, which means we have apoptosis, which is normal for our hair, for our skin, for some cells from our gut. It's normal to have apoptosis. It dies and it's okay. But when you have pyroptosis, you have inflammation with the cell death. That's what happens when we have acute tumoral lesions, for example. So ozone can decrease this inflammation caused by the death of some types of cells. Ozone can also stimulate the cytoskeletal organization and maintain the optimal activity of the survival machinery of the cells. Ozone is also interesting because it interacts, and this is very new. It's from 2000, 2003. Ozone interacts with aryl hydrocarbon receptors. And what is this? This is a transcription factor present in different cells and in inflammatory cells, and involve the regulation, the balance of the immune response. So at low dose, ozone will act through these aryl hydrocarbon receptors to balance inflammation, will also activate NRF2, which mediate activation of the antioxidant system, and also have an anti-inflammatory effect via triggering the release of low dose of aldehydes. So ozonides formed by ozone interaction with plasma in lipids and other molecules in the blood or in the tissue will form some oxygen species or lipoperoxides, which are enabled to rule the major molecular action in the ozone in the cell. So it will work as a bioregulator and will also help with fundamental mechanism of surviving in the cell. So we can have different actions and have the ozone molecule working as a bioregulator. So this image highlights this idea. So you do ozonated major blood therapy, you have the release of aldehydes, you have the species of oxygen molecules as signaling molecules, and it will act on the inflammatory complex, causing inhibition of the pyroptosis. This is also very interesting. Low concentration of ozone cause the release of aldehydes that will switch off pro-inflammatory signs in the innate immune cells. So aldehyde will switch off the stimulation of inflammatory signs. It will also induce the signaling system of NRF2, which will cause gene expression of genes with antioxidant action. It also activating NRF2 inhibits the activation of NF-kappa beta, which is a pro-inflammatory factor of transcription. Clinical correlation. So we know that we can act in the immune system. Let's put this in a paper on a disease. In this case, it was studied the effect of ozonated sunflower oil on the lesions caused by leishmaniasis. So they have some mice that were treated with conventional treatment with antimoniate meglumine, and they also use ozonated oil on the lesions. What they saw was lesions thickness and their parasitic burden. They saw that we have a decrease in the inflammation, not only on the local that was applied the ozonated sunflower, but we also have a decrease on the systemic inflammation. So when you associated ozonated oil with conventional treatment, we have the best performance in the improving of the lesion. So the ozonated oil could enhance the leishmanial activity in the treatment, the leishmanicidal activity of the meglumine antimoniate, and could eliminate the parasites in the lesion. And also we have an immunomodulatory action that was systemic. We have a decrease in the tumoral factor level from the macrophages and in the blood leukocytes. So this is a case of leishmaniasis in a dog. This is from Portugal, where we have seen this dog. And we can use the conventional treatment with glucanthine, and we can associate it for the lesion, the ozone oil, with short treatment time for the patient, less exposure to the side effects of the standard long treatment. So ozonated oil proves to be an immunomodulated agent, can act in the nitric oxide pathway, cause an increase and decrease in its production depending on the dose used. Of course, the effect is dose dependent, and it can affect some systemic inflammatory parameters, just like TNF and number of blood leukocytes. This is another interesting study where they found the effect of ozone on inflammation. They create a model of uh, acute gout. So it's a disease on the articular joint that's very painful. And they found that ozone could reduce neuropathic pain, treat the chemoentteritis caused by the conventional treatment, and it worked by activating AMP protein kinase. So the intraperitoneal injection of ozone increased the AMPK in the blood. And what is the importance of this protein? It could inhibit the neuroinflammation by upregulation the expression of another protein or transcription factor. So what we can see here is we have different signaling pathway for ozone to act. It's a very hard biochemical process, and this is something that's when you inject ozone, it will vanish, but we will have a link of different biochemical process, and each of these process will act in different receptors or in different uh, process causing different biological effects. So ozone block the reduction of AMPK expression, and this AMPK can inhibit the oxidative stress and inflammation. So it can also use to counter counteract the collateral effects of metformin, anti-inflammatory action of methotrexate, salicylate, and others. So here we can see the effect of ozone on modulating the AMPK factor and decreasing the inflammation. Ozone, high or low dose. So we know, and this is important that we know that high doses of ozone can cause inflammation by activating the NLRP3 complex and downregulation of NRF2 due to NF kappa beta upregulation. So we have NF kappa beta, which is pro-inflammatory, and we have the NRF2, which is anti-inflammatory. So effect of ozone will depend on the dose you use. So that's why it's important to have guidelines. It's important to have patterns of doses. So this will lead to a marked inflammatory response ruled by NF kappa beta and cytokines. So should we use high doses of ozone? It depends on what you want. If we want to direct injection of solid tumors, like we saw in this paper, this will cause inflammation, necrosis, apoptosis, cellular stress, and decrease the tumor. So maybe I want all this collateral effect if I'm dealing with tumor. So if we are going to have expression of antioxidants or inflammation, it depends on the balance. What balance? Low dose, high dose. And this is the doctor who will decide during the treatment, searching for the best treatment for each disease, each species. So we can cause inhibition of NF kappa beta using low concentration, or we can have stimulation of it using high concentration of ozone. So, for example, this is a case of equine melanoma. I can try to decrease this mass using high concentration of ozone. This will cause necrosis. This will cause the tumor to be destroyed or to lose its um, consistency. So I want this side effect because it's a tumor. Ozone can increase oxygen in tissue. This is a study that we are going to do a parallel with it. During COVID, the COVID problem, physicians were trying to improve ventilation without using the respiratory system, without doing this by the lungs. So they were trying to perform enteral ventilation. And they found when you put oxygen in the gut, in the rectum, you can increase the oxygen level of the blood. So why not using ozone to perform that? So that's the idea. When you do ozone therapy, you are also putting a lot of oxygen in the gut via rectal insufflation. And this can, of course, improve blood oxygenation, and we can use this for patients that have lung problems. Ozone also increase the 2,3-bisphosphorylglycerol glycolytic process. When we do that, when we increase this glycolytic process, we decrease the affinity of hemoglobin for oxygen. And this is going to facilitate its release, the oxygen release from the hemoglobin. So we have more oxygen being delivered to the tissue. So you are going to put oxygen through rectal insufflation, which will cause oxygen in the blood increase. And we can also have this inhibition of the affinity of the hemoglobin for oxygen, which will make the release of oxygen to the tissue. Ozonization of fluids. We know that we can also ozonate glucose solution. First of all, we were just thinking about saline solution. Then we come up with Ringer lactate solution, which is the one we use mainly for intravenous use. And now we know that we can ozonate 5% glucose solution. And this is interesting because when you have a patient in intensive care, this patient might have some hypoglycemia. And we know that ozone can decrease the level of glucose in the blood. So if you have this kind of patient that might have some problem with the glucose levels, ozonating the glucose solution might be a solution. It's important to have a microbiota balance, and ozone can help with that. We know that we have a gut-brain axis mediated, which cause neuromodulation and neuroprotection. So we know that even in a peripheral nerve injury, it can be uh, stimulated, or it can be, we can have a process that can be inhibited or stimulated with a uh, intestinal microbiome manipulation. So we can induce a anti-inflammatory response when we modulate the guts, even for a spinal cord injury, even for a peripheral nerve injury. And ozone can help with this microbiome balance. That's why I put this paper here, just to highlight this idea. So when I have a peripheral nerve injury, instead of just trying to inject local ozone for treatment and try to go directly through the problem in the brachial plexus, we can also address the guts and do rectal insufflation so we can balance the microbiome, which will reflect on the inflammatory process in the nerve or in the spinal cord. Ozone mechanism of action in microorganisms. We have in vivo and external use. We should always remember to use low concentrations for immune system and use high concentration for external use, which means when I'm going to have direct contact with microorganisms, we can use high concentration, like fluid uh, for washing some wound, gas bagging, or when we are using ozonated oil. But when you are doing rectal route fluids or minor autohemotherapy, we are doing and we are working with low concentrations because we want an indirect effect. So this is another studies on the bioregulator effect of ozone. And they talk about this indirect reaction, indirect reaction. So when we are thinking about disinfection, when we are thinking about direct contact with microorganism, we have a direct reaction with high concentration. When we think about indirect reaction, when we think about immune boosting, we are talking about low concentration. So this is important to have it in mind. So this is a case of lethal peritonitis in an animal model. We have the best survival with 10 micrograms per milliliter than with high concentration. Why? Because we are talking about internal reaction, not direct or external reaction. So we should use low dose to stimulate the self-defense. So comparing with antibiotics, ozone was much better than them. This is another interesting study on experimental, in fact, pancreatic necrosis. But in this case, they use high concentration, 4 micrograms per milliliter, and they found that it was more efficient than antibiotics to control the infection in the pancreas. So we can use, for example, ozone in emergency for peritoneal pain, doing directly application of ozone intraperitoneal. If you are not used to that, it's better to use a ultrasound to guide you. But here we are using a very thin needle, and we can also use rectal insufflation. So patient is very painful in the emergency room. They have tried different drugs. So we associated for pain control ozone acupuncture as well together with conventional therapy. Ozone for neurological disorders. We know that ozone can also have a neuroprotection effect. So it can affect the cell motility and secretion of pro-inflammatory cytokines. So it can have a neuroprotection effect for neurodegenerative disease. So low dose of ozone does not affect the microglial cells. Ozone can decrease cell motility and pro-inflammatory cytokine, and ozone can potentiate the effect of anti-inflammatory drugs, which means that we can associate ozone with conventional treatment. And this is very important because most of the time we are not going to use ozone alone. but we are going to use ozone together with conventional therapy. This is a study on coronary disease. This is a Russian study from 2023, and they have seen a improvement in the angina when they use ozonated saline, comparing it with conventional treatment. So it's a very simple treatment. You are going to ozonated saline using conventional treatment associated with saline. So why not? That's the question. And finally, we are almost on our time. I just like to show you these oncological studies on ozone combined with CBD. So we can see that ozone combined with CBD in vitro studies can be very effective to uh, induce changes in the expression of genes related with cancer. So here we are talking about epigenetic. Ozone associated with CBD can make genes that are related with metastasis, with tissue invasion, decrease its expression. So ozone and CBD can control the expression of genes that we call oncogenes that are related with progression, metastasis, and chemioresistance. So, two information that's really interesting. First, they can be used for pancreatic cancer. Second, we can mix together with ozone with CBD, and we have a potentiation action when we put them together. And what are the effects of CBD? It acts regulating genes involved in cell cycle progression. So it makes downregulation of cyclin A2. And ozone, it will also act on the cell cycle by downregulating cyclin-dependent kinases, and also upregulating CDKN2A expression, which is a protective gene. And just to finish, we have a case of GBM in a patient with poor prognosis who following partial removal of neoplasm refused conventional therapy due to personal serious side effects. The patient started ozone therapy with cannabis and melatonin. This approach resulted in a complete and durable disease remission and long survival. When this paper was published in 2023, ended the patient was still alive. So here we can see the glioblastoma. That's the most aggressive neural tumor or brain tumor in the patient in 2016. And then he took it away. And in 2022, we can see that it was took it away by surgery, but not everything. Of course, it's impossible to cure a glioblastoma until now with conventional medicine. And the ozone therapy protocol, he uses a high concentration of ozone. It's 80 micrograms per milliliter with weekly use and the volume of 2.5 milliliters per kilo. And then he keep it for 2 months on daily administration for 4 consecutive days. And after all, he discontinued the treatment for 3 months and then he started it again. And he's keeping this way. So the guy was treated for glioblastoma using just ozone therapy associated with cannabis and some melatonin. So they discussed the mechanism of action of CBD, which is binding CBD receptors that is overexpressed in the tumor, especially CBD2. And they don't talk too much about the ozone mechanism, but it doesn't matter because we have many other papers that highlights its effects. So we have more effects of ozonated oil on cancer cells. And this paper is really interesting because it says ozone can be effective for the cancer cell, but ozone does not affect the health cell. So this is amazing because we can affect the the tumor cell, but not the health cell. Well, we are in the end. I just would like to tell you that ozone is safe and dropping free technique can be used in rehabilitation or internal medicine, can be combined with conventional treatment. Its mechanism of action is complex and there is still a large area to be investigated. And its therapy in evidence that tends to grow annually in use, research, and indication. When we talk about collateral effects of ozone, it's not ozone itself. It's always the technique. It's always something that the therapist cause. So when we have problem with ozone, the problem was not the molecule. The problem was the skill, the ability of the professional that did something wrong. The same happens with surgery, with some drugs and whatever. Thank you for your attention.